each and every egg in the... It just started. It just started. All right, good morning, everybody. We will make a start for the day. So thank you all for making your time available. I'm sitting here in my lounge with my two children playing on their technical devices to keep them quiet. So, we totally get if there's distractions and things happening in this new way of connecting that we're all trying to deal with. I should introduce myself actually. I'm Trina. I've met a lot of you over the years. I'm the General Manager for PADA. Luckily, PADA is set up that we can work from home. We use everything in the cloud, so we're quite resourceful. So we're facing a lot of the same struggles as all of you of trying to find a new way of connecting and supporting the work that you guys are doing, as well as essential workers and frontline workers. So thank you to all of you for the work that you are doing. I know that there is a lot of online education happening at the moment as well. I also know that Chelsea Winter's doing a Facebook Live at the moment too. So hopefully she's creating something amazing in her kitchen that we can all tap into later on. So what's come out of COVID is sort of a way that we can help work with you. So we've created a resource called Pregnancy and Birth in a Pandemic, and that's what we're talking about this morning. This is our first time doing a Zoom session like this, so please bear with us if sort of anything sort of goes astray. We've got the chat function, which hopefully if you move down the bottom of your screen, you can see a little bubble that says chat. That is how we would like you to connect with us. We will be keeping everybody on mute just to minimize that background sound, just so we are focused on what Liora will be talking about this morning. So the best way that we sort of thought about doing it is ask your questions in chat, and we'll go through those in the order that they appear as well. Somebody's just asked a question, is it okay to share your pamphlet with our clients electronically? Yes, please do that. We don't have any paper copies printed just because we can't get anything printed at the moment. So do please share that electronically. It's available on our Facebook as well if you want to direct people to that. It's the download on our website as well. Otherwise, you've got that link in the email that I sent you earlier. Feel free to share it in that way as well. Just a little thank you for Zonta, which is an international group about empowering women, and the funding for Leora's role comes from the fundraising that Zonta do for us. So we've been chosen as the national charity for this current biennium, and we get a small amount of their funding that goes towards Leora's role. So I will now hand over to Liora, and she can take us through the resource, and then we will go through questions, and discussion will be very difficult with 100 people. So we'll ask the question, Liora can then answer it. But if anybody feels that they have valuable input into what's being talked about, just type into the chat and then we'll give you an opportunity to talk as well. So if that works, great, give us a thumbs up and we'll get started.
Kia ora everyone, good morning. Liora in Wellington, my teenager's bedroom, so apologies for the artwork in the back. It's the only quiet room in this very busy household right now. We live in a very small place and have a new puppy and lots of things going on. Yes, so I'm here mainly to present the resource that we wrote about 2.5 weeks ago, just when the lockdown started, and you realize that there's a lot of stress and anxiety going out. I think somebody has their microphone not muted because there's a bit of background noise. So we realized there's a lot of anxiety, as we all know, going on. And we thought about a short, succinct way to present to the moms the message we can give them, not only moms, families. For now, what messages can we give to families in these days? And yes, please spread the, feel free to take this handout and this resource and just spread it out as far wide as you can. I do want to acknowledge that it wasn't me who wrote it. I mean, I kind of put it together, but I found pieces and bits in very different places, which I thought were, oh, this is good. And I just put things together. So there is, you can see in the resource itself, there is credits for some people who did help me with this. And a lot of it is taken from ACT, which is Acceptance and Commitment Therapy, which if you don't not familiar with, I really encourage you to go into ACT, and I'll show you something as well. Well, we start going. Who I do know some of you, and some of you do know me, and there's a lot of bigger experts than me in this room. So please feel free to share your knowledge if we have time and if we have the way to do it. But just apologize for my accent. If you don't know me, I am from Mexican and Israeli background, so Spanish and Hebrew my first languages. English just came very late in my life, so that's as a way to apologize for any kind of grammatical mistakes or not very strong English skills sometimes, especially when I'm a bit nervous like now, because I love presenting, but not in this way. So I'm a bit more nervous than usual, but I'll do my best. So I'm going to share with you now the resource in case you haven't seen it. And let me just find it. It was supposed to pop right on, but I'll find it.
Oh, sorry. It's just popped up on my computer.
Can you see it now? Are you seeing it? Okay, just a second, because I can't see you right now. Let me try again. Okay, somehow I'm not able. Trina, can you bring it on? Because somehow it's not working for me to bring it on. I'm not sure why. There you go. Thank you, Trina. Okay, so I'm just going to talk through this resource, which right now I'm not seeing big enough. So I'm going to leave this screen and just put it on my bigger screen so I can do it. So the first page is really what are we telling moms about how we feel their pain, really know what they're going through. I don't know if you're aware, but there's a huge Facebook page that was set up by Eva Neely, who's a lecturer at Victoria, for moms in the pandemic. And there's lots and lots of stress and anxiety going through that Facebook page. And the main things I saw was, in the beginning, it was all about how do I get all my things before, if I have a baby now, because I don't have anything. And people have already resolved that. But there's a lot of, the two main things that I know you're all aware of are how I'm going to be able to cope with having a baby and being alone in the postnatal unit, because my partner is going to have to leave right after the birth. How do I do that? How do I cope with that? And the other huge thing going on is my family was supposed to come and be with me. My parents were supposed to come with me, and now nobody's coming, and I can't do this on my own, or I can't do this just with my partner. So the first page just acknowledges all that anxiety and stress going through family right now, and just saying, we hear you, we know, this is really, really hard. Nobody wanted to have a baby like this. Nobody wanted to have, postnatal stay without your partner. Nobody wanted you to go through this alone, which many moms are feeling these days very, very, very much alone. So the first page just acknowledges that. If you go to the next page in the resource, so this again is taken from ACT, which is Acceptance and Commitment Therapy. And the whole research talks about how there's so many things we can't change. And we can't change the pandemic. We can't change the levels. We can't control all of that. So what can we control? So it's small tools and skills to give our moms or our families about things they can't control. And one good way to put it is BACE. So B is what, and your moms are encouraged to do each one of those, BACE, every day. So the B stands for your body, taking care of your body. So we can all talk to our moms or pregnant moms or postnatal moms about taking care of their body, making sure they do eat those balanced meals, making sure they do go to sleep essentially every night around the same time. So the sleep hygiene, the nutrition, doing some exercise, really encouraging our parents to go out. We are so lucky in New Zealand that we can actually go out and do exercise. My sister in Israel, who was actually very sick with the COVID-19, she can only go for 50 meters outside of the home. In Italy, I just saw that they only allow now 200 meters and for 1 hour a day. We are so, so lucky. We can actually go for a nice long walk. So encourage all our parents to just go out. If they're really scared, go out in the morning, go out in the evening when there's less people around, but have them just go out for their walks. A is for activities that give you a sense of accomplishment. So finding something, knitting that baby jumper you always wanted to knit, learning how to crochet so you can crochet your baby's beanie, something that gives you accomplishment, making some nice muffins for your family, something will make you feel that actually I did something for myself and my family today. C is for activities that connect you with important people in your life, for connection. So again, encouraging our families to find a way to every day connect with somebody. Now we have the time to talk to people we haven't talked to in a long time. Pick up your phone, pick up your Facebook Messenger, pick up somebody, you know. And hello, welcome. And connect with somebody out there. And E is for activities for enjoyment, which is so important as well. Find something fun every day. Find a really good comedy in Netflix. Find something that really makes you laugh. Make a competition with your kids if you already have other kids. Find something that really makes you just enjoy life. So again, just going back to the small things that every one of us should do in our lives to just feel a bit more in control and just to have a bit of more good times in our life and not just stressful times. At the bottom is a bit of other ideas you could try, like having this kind of toolkit for yourself that just helps you get through rough things. And if you have a child at home, helping them take a box and put things inside that really makes them feel better when they're stressed. It's a stuffed animal, something they can touch, something they can smell. Good for moms and kids as well. Just have some toolkit. So if you go to the next page, thank you, Trina. Again, some big things that we can all do, and all of us should do this more. Cut down on the news. So again, trying to tell our parents and ourselves, just go once a day or maybe twice a day to the news. Don't do it all the time. Don't keep looking at stuff every half an hour to see if something changed, because nothing really changes. Maybe see the update that's given every day at 1 o'clock and that's it. Maybe just one more time, but really cutting down on news, especially important if there's other kids in the home and you want to lower the stress levels. Take it moment by moment. Nobody knows when it's going to be ending. So we just have to take it day by day, hour by hour. What am I doing today? Making a plan every morning. How am I passing this day as best as I can be? Reminding yourself this is temporary. It's going to go away. We're going to go back to our whole new world and a whole old world. I don't like the whole media thing that I see sometimes, that life is never going to be the same again and the world has changed forever. We can't give those messages to parents. We have to keep sending messages that are actually, we will go back. This is all temporary. And reach out for help, because we, all of you, are still out there and you're still all giving support. So we need to remind families we are still there for them in a different way, but we are still there for them. So reach out. If it's either for the 1737 text, if you don't have a counselor, or the depression line, or just get your own counselor that you know and just reach out. And the last page. Be kind to yourself. I think when Jacinda said be kind, the first person we have to be kind to is ourselves. All of us are seeing parents feeling a lot of stress about having to do the school and the pregnancy and everything on their own. Be kind to yourself. We're seeing lots of really good messages out there to families. You can't be the perfect parent, especially not now. Let your kids be in the screen more than usual, and really try and find ways to be kind to yourself and to everybody else. So really forgiving yourself and really finding that peace within you to tell yourself, this is really rough, but I'm not going to make it worse by just being stressed about how am I not functioning. I'm actually going to forgive myself and I can't function right well, and just be really kind to myself. That self-compassion is huge. Supporting other tamariki. If there's a mom who already has other kids at home, this is extremely stressful, and I've seen lots and lots of stories about moms that have a 2-3-year-old or even a 1-year-old and now are due, and who's going to come and help them, and there's nobody out for them. Especially single moms. I'm working on the telephone COVID-19 response line, and people call me and I just can't believe the stories. A mom who's 19, has a 2-year-old with autism, and now baby and pregnant, and how do they do it? And just realizing those people out there need a lot of support, but just making them, giving them those tips and ideas how to really make it easier for their other children. So just all about keeping the house and the bubble as calm as possible, and not going into the news every time and not talking about it too much, and just really understanding that kids can really be acting out right now and being as we can, patient with them, but also again that self-compassion. We can't be perfect parents. And at the bottom, we do have the midwifery care. So they have the links to go and see, because things keep changing and evolving, and we don't really know how level 2 is going to look in terms of midwifery care. But just so the websites to go and look at what is going out there in real sense. So that's our resource that we developed. And again, you're free to share with as many people as you want. And I am going to try and share now something from, oh, Trina, if you stop sharing your screen, I can just try and share something from my screen. Thank you. I do want to share with you, in case you're not aware of. Okay. Now, can you see it now? Yes, now you can see it, right? Yes? Yes, okay. Possums, if you don't know of possums, it's a clinic in Australia with Dr. Pamela Douglas, and she does wonderful work with both breastfeeding and mental health. And there's lots of really good tools here to give our moms that pertain to ACT, acceptance and commitment therapy. So it's all free, and it's small videos and small vignettes to help you just how to support moms with those tools of ACT, of really accepting reality as it is, and just having self-compassion, and then committing to our values and taking actions that go with our values to just try and deal with really stressful situations. And the other one I wanted to share with you is, I'm sure you all have seen this, but it's really well done. So that's done by our government. Well done, but if you haven't seen it, you should look at it. And it's just a COVID-19 support for whānau and wahine and new mama that's developed by the government, and lots and lots and lots of really, really good information. So definitely something you need to look at if you haven't. Okay, Trina, do we have some questions? You need to unmute yourself, Trina.
Right, so Kirsten Stewart, she says people can get referrals through their GP practice to the primary mental health contract. I work for a PHO in Waikato, Hamilton, providing brief interventions, full sessions of counselling. We're doing this virtually or telephonically. Different PHOs do this differently, but contract is funded by the DHB for primary mental health services. So that sounds like a really great service, Kirsten. Would you like to elaborate further about that? Do you want to unmute yourself and talk about that?
Sure. Yeah, unfortunately, I don't think many people know about this service unless they end up in front of the GP and the GP makes a recommendation. The way that it works with Hauraki PHO, which is who I work for, is that any of our GP practices that are registered with us just make a referral from a consultation with one of their patients. We process the referral. Most people are being contacted within 24 hours and having an appointment within a week. So obviously different PHOs do this differently. Some don't have a primary mental health team like Hauraki PHO does. They refer to outside counsellors or psychologists depending on the needs from the referral. But this is a contract from the DHB. So whatever way they do it, there is a primary mental health service available if people need it.
Excellent. That sounds really great, Kirsten. It's good that they've been proactive and put something together as well.
Yeah, this is available all the time. So whether it's COVID related or anything to do with a primary mental health issue, something that can be dealt with in a brief intervention, not things that adult mental health services or secondary services deals with, but this is just sort of the everyday, normal ups and downs, difficulties, stresses, life experiences.
Can I ask a question? I'm just really curious because I'm struggling with the idea of the level 3, if we can actually run P&D support groups, not on Zoom, if we have a huge room and we're keeping moms very much apart and we're doing all hygiene precautions as necessary. Has anybody thought about doing that, or are you all thinking that we have to wait until level 2? Level 2? Is that the agreement, level 2? Anybody thinking of doing that at level 3 with a big distance between parents? No? You think it's too early? Even though our moms are desperate for the support. Okay, thank you.
Great. Christina, do you want to tell us about the 0800 number that you guys have set up and the support that Mothers Helpers is offering as well, please?
Sure. Yeah, we were fortunate to get a little bit of funding from the government to set up an 0800 number. We're relying on, we've got registered social workers and counsellors. And actually, Lisa Gear, who is actually in this chat, she's actually taking calls with the 0800 number during the day. So basically, we've increased that. So we've got that 0800 number going to live to someone to talk to. But we've also increased all of our support groups. So we've got a Preparing for Parenthood group that helps to support women who are pregnant, but not just women, their partners as well. Their partner can join as well. We're running it online, and the focus of that group is to provide kind of support that actually would help to prevent depression or anxiety from occurring. So it's kind of trying to look at the preventative side of things. And our perinatal depression recovery program, it's called Out of the Fog. That's a really effective program. We have a 52% reduction in symptoms of depression or anxiety, and 76% of our women are well by the end of the program. We're running it all online, so it's nationwide. It's available to all women nationwide. We ask for a donation, but we don't, if they can't afford that, and a lot of families can't afford that at the moment at all. So we make it available as a free service. We also do assessments with our social workers and counsellors. Even if they don't want to go on the program, they can have an assessment, a free assessment with us. And we put them in touch with other supports depending on what their needs are and what they're looking for. So that's something that we're providing to women, and we've always have provided that, but we've just increased that service at this time. I'll put in the comments how you can refer a mum to our service. I'll do the 0800 number, but also the link.
Yeah, excellent. Thanks, Christina. Somebody said what area is Mothers Helpers operating, but it's nationwide, and you've got that online service available as well. Now, Erin from P&D Canterbury, or Perinatal Wellbeing, now known as, she says that mums don't want to come face to face with groups yet, is their feedback. So it does look like alert level 2 is when people are going to want to start having more connection, just being aware of the social distancing as well. Tonya McRae, we have the EBPHA, but it's the same as the Bay of Plenty. The counselling service is overrun and often just get referred to secondary services if they're pregnant or postnatal. Tonya, do you want to elaborate on that for us, please?
Hi. So we have very little primary service in our community, and what we see happening is that we get most of our referrals just as soon as even if they go through the PHO, which was mentioned before, which is our PHA, they end up coming to us anyway because they are a general counselling service. And so as soon as they sort of see that the person might be pregnant or postnatal, they will refer straight to maternal mental health. We haven't found that's happening at the moment, I must admit. Our referrals, I don't know how everyone else is going, but our referrals are down. I believe that's to do with the fact of the people not wanting face-to-face contact at the moment. So that's kind of where our service is everything I'm doing is tele communications at the moment. I don't even do Zoom with my clients. I have to say, for the most part, they're doing really well. So I'm really happy about that. I think that life's a bit calmer, to be honest, for some of them.
Trina, you need to unmute. We can't hear you.
Oh, sorry. Good old technology. Just going to say, has anyone got any comment to Tonya? Has anybody got sort of something similar happening in their area as well? They found that referrals are down and that people are just sort of trying to sort themselves out, or sitting waiting until that time when they can actually go and get physical help.
Yeah, I think working for a PHO, we've definitely seen GP consultations decline quite dramatically. Although the message has started to be shared on TV that GPs are still doing virtual and telephonic consultations, and they can do face-to-face if needed. I think a lot of people don't know that. Maybe they're getting their info from social media, and I haven't personally seen that message spread so widely. So definitely we've seen a reduction, which we're a bit concerned will result in more severe physical and mental health issues later down the line. But yeah, so we're thinking of some ways that we can share that message through social media at the moment as well.
I just add, I think what may be happening is that women don't know what's available and what isn't. And so I think what would be really, really helpful is for us to share a resource around, because even I don't know, like I just talked to Bellyful just now, and they are deciding whether or not they're going to be running during level 3 or level 2. So there's a lot of uncertainty, and I think when people don't have when they have uncertainty, they tend to just assume it's not available. So I think it would be, I think it would be really helpful to kind of have some resources to say, this is what is running and what is available, and this is how it's different. And that way people will, because we're absolutely seeing more anxious, I mean, all of us will know this, but more anxious women, women with their mood much lower and that kind of thing. So we want to make sure that they know that that there is support out there, but we need to get that information out to them with quite a comprehensive list of resources, I think.
Yeah, I think that's an excellent idea, Christina, and that's something that I was thinking in my mind as well. The PADA website, pada.nz, we have started up a COVID page as well. We know there is so much information out there, and people are just getting overwhelmed with the amount of information and what suits people in the best way. You know, what is good information, what is poor information, and it's just trying to filter through what is going to be useful in the best way. So, I mean, we're happy to collate that. Feel free, please, if there are services that are operating in your area that are providing good support to mums and dads during this time, send it to us. We'll make sure it goes through into our website, into that COVID section, and also on our Facebook page as well. Hopefully you're following that, and we're just sort of constantly putting out good information and just anything that's sort of going to be useful during this time. Now, Sue Miller from Plunket, do you want to talk? She says that Plunket staff are all directed, that there's no face-to-face and alert level 3 for all staff. You can just let us know, Sue, what's happening with Plunket would be great, please.
Okay, so Plunket, we're directed nationally on what we can and we can't do through the alert levels, and so because Plunket's a well child service, I guess it's trying to protect families from the transmission, so from a huge national staff going out and doing all those face-to-face contacts. So what we are doing is we've got a prioritised virtual service. So for all our lower need families, we've kind of cleared the decks really, and we're aiming to stay in contact with all our new baby case referrals and babies up to 3 months, all our high long-term families with more complex needs, our Māori and Pacific families who, you know, looking for health equity, and thinking about our treaty obligations there, and also refugee families. So all those families that might be at high risk, and certainly all the families that have we're identified as having some issues around anxiety, depression, maternal mental health. There will always be families that we miss, that we've assessed as low need, that have a lot of anxiety and things going on. But I guess we can only do what we can do, and for those lower need families, there's a lot of other platforms and forums that we're hoping that they can get onto to support them through that. So, you know, part of me being here today is looking for more resources to be able to send to families. So we're communicating by phone and a lot by Zoom, and Zoom's been really, really useful because it's an amazing assessment tool. You know, we get to see babies on the Zoom, mums can put their cameras up, and we can do sort of a modified top to toe assessment, look at baby's growth, talk to mum how she's managing, see what that family environment's like and who her support people are. And we've had some really positive feedback from families, actually feel quite well supported. And once you've reassured them, you know, because often they come to Plunkett thinking that the weight and the length and everything is the be all and end all. But it's checking in what's on top with them, how are they managing their bubble, who's in their bubble to support them, and for them having more faith in their ability to parent. What are you seeing for your baby? How do you know your baby's growing? You know, they're growing out of clothes, are they getting little fat rolls around the top of their thighs, lots of wet nappies, lots of dirty nappies? And what it's doing is giving mums more faith in their own parental abilities and instincts and ability to judge for themselves how their baby's progressing. Hopefully, at the finish of Alert Level 3, we haven't heard yet, but hopefully we'll start our face-to-face through face-to-face meetings again. A lot of the injury prevention service and our community support services are doing a lot of group Zoom meetings like this. They're doing music and movement through group meeting, play groups through group meetings, car seat information and support through Zoom meetings. So lots and lots of support going out to groups that way as well.
I just want to say, I just saw somebody, thank you, so that was very, very valuable. And I do see what you say. I work as a lactation consultant also in Zoom, and I can see how really we empower parents to actually really look at their babies and see on their own they're actually doing well. And I really hear your words, and I think it's huge what you can do in that way, definitely. And I also saw that Jill said that some clients are actually doing better. And I do see that as well, and that's really encouraging. So some moms are actually doing so much better than the partner now is home. And it's lovely to hear them and see the improvement. So also we have to keep that in our minds as well. Some people are actually doing better, which is lovely and beautiful to see. Yeah, thank you.
Great. Abby Hollingsworth, these guys are based in the Wairarapa, and they've set up a group called the Ruth Project, and she says that they've moved to online. And we have one referral from a midwife. We also have done live chats with our clients to get information out. But something we need to find is similar, what places locally are available virtually and phone for them, and how do we get them connected, which is probably through Zoom meetings. That's probably about right. Is anybody else from the Wairarapa that's here as well? Or is there nationally sort of groups that, I mean, that's the thing about having digital tools. You can be anywhere in the world, can't you? And you can pretty much connect with anything and anyone. So has anyone got some suggestions for Abby of ways that they can help connect their mums? Or Abby, do you want to unmute and sort of chat to your talk as well?
Sure, hello. I just flicked the video on because I've got the kids as well. Apologies if they run in. Yeah, so obviously we're mostly online, which is similar. And I was just going to say as well, because Hella's in the conversation too, some of our clients, I agree, are actually doing better being at home, because one of them said that the anxiety is lifted because she feels like she can control her family in her own home, clean environment. So I guess that's forward thinking for us, is that as things get lifted, that's probably what's going to start triggering off some of the anxiety again, because those new security things that they've created are now going to get taken away. And there's one client that is in probably a high need situation who could really do with counselling, and that's my task now, is to try and find how can I get this family connected to a virtual counsellor or a phone counsellor. And over the last couple of days, I've heard that Change Abilities here in Masterton are still available. So trying to, again, it's that same thing, getting that information out to our clients, which for ourselves, we set up a live chat that we did our first one on Friday night, and the clients all responded really well to that. They really enjoyed being able to hear from us and see us and get the information straight to them and ask questions. But I think that's probably how do you then get them to those virtual phone conversations, when for us a lot of our work is practically we'll pick you up and we'll take you, but we can't pick anyone up and take them. So my problem solving is creating a Zoom meeting, I guess, with inviting someone in that can come and talk to them, or going the other way of finding people, health professionals that would be happy to join in for a live chat on a Friday night and they can ask questions.
I mean, Christina, with your 0800 number, that sets up people to connect with a counsellor. Is there any further then other groups that have been set up from that as well that other people can connect into?
Mom.
Hang on, sweetie.
I'm not sure I understand what you're asking, sorry.
Well, you've got the 0800 phone number for counselling services, but I know Mothers Helpers also offers other online support groups, and are you guys doing Zoom chats as well? Yeah, so all our groups are, so just to clarify again, it's nationwide. All of our groups are run online. We've actually been running online groups for years, and we've found that they're just as effective. It's a totally different platform, but actually this platform's quite familiar to us. And what we've found is that it's really effective, just as effective as if you're in the room. It's just different. So we still are able to create a really effective, supportive, strong bond between the women. I'm not sure I'm answering your question, Trina, but the other thing, sorry, but the other thing is that I think I mentioned before, we do assessments. So that before we put, our whole point of our assessment is to find out what are the main, obviously what their strengths and resources are, but what are their main issues that they're facing, and then actually work with that to find the best outcome for that person. So that the best outcome for that person may not be one of our preparing for parenthood groups. It may not be our perinatal depression recovery group. It may be that they would actually prefer to see a private counsellor. It may be that they need some more information about something. It may be that we need to put them in touch with their GP. It may be that we have to call the crisis team. It just, every situation is different. And so, for us to know what resources are available out there, it's hugely helpful to us, because, for us to know what is there locally, what's happening locally, we can actually tell that, well, you're in the Wairarapa, this is what the Ruth Project is doing, maybe we can put you in touch with them. So that's sort of, we try and sort of look at things in a very holistic way, and we sort of think, well, the more support that this mother gets, the better, and whatever works for her works, sort of thing. Yeah. Does that answer your question? Yep, that sounds great. I mean, it's collaboration, isn't it? It's connecting everybody and having those services available in the right regions that are actively helping to support those mums and dads that are going through this rough journey. Now, there was a question about midwives as well, about what physical checks. Michelle, do you want to talk to that? Michelle Lomax?
I don't know if I'm the only midwife on here. I'm a core midwife just at North Shore Hospital. I only work there once a week. And obviously you are still hands-on, still they're very much physically there for them, but the anxiety is incredible because they're on their own. But from what I can gather with the community midwives is that they have a variety of strategies for checking in on their women. And there is a document out from the College of Midwives that suggests what meetings need to be face-to-face and which ones can be virtual. But I've heard of things like women, it's actually a lot of it's to do with the women as well who do not want anybody in their bubble. And I've heard of women that will do baby checks by doing, as you said, using the phone and showing the baby's bottom and weighing them on their own kitchen scales and all this sort of thing to circumvent anybody coming into their house, down to being met at the door and the midwife having to, on the deck or at the front deck and the front door, weigh the baby, check the baby, ask the questions. Very little physical contact. So yeah, it's going to be interesting, but I don't know how much will change coming into level 3, because it still does say, that you can have certain people into your bubble, but when it's a midwife that may be seeing 10 to 15 women in a day, that's probably still not going to happen. So I think most of the clinics have become virtual. I can't speak for the community because I'm not a community midwife, but what I've been hearing on the meetings is that they are changing a lot. We've got another meeting, an NZCOM meeting on Wednesday, and I'm assuming it will be discussed there as to what will change. So yeah, if anybody wants to go into the NZCOM meetings. Yeah, when is your next PAD, or I can send an email through when I'm hoping I can go to that meeting. The problem is I work for AUT, so I actually have Zoom meetings all over the place, and I think one of them clashes with the NZCOM meeting, but I can, they send out newsletters. I could even forward a newsletter to somebody if they wanted, that may give a bit more information. And also maybe the recommendations from NZCOM about what meetings need to be face-to-face and which ones don't, if you're happy with that.
That'd be great, Michelle, if you don't mind sort of being a liaison and us sharing that information. I mean, obviously a lot of us do get the newsletters and valuable information that the NZCOM is sending out, but just to have that as an extra follow-up would be really useful, please.
Absolutely, yeah, it is. It's very uncertain for these poor women, and it makes for a lot more work, I must admit, as a core midwife, because we're not only, normally we rely on their support people to be there to help them go in the shower or go to the toilet or just hold the baby, and I have discovered in the last 4 or 5 weeks the amount of extra work we have, where we're counsellors, we're second people, literally having a baby under your arm just so they can go to the toilet. It's and they're moving out as quicker than they probably should be. They're leaving hospital way because they just don't want to be in there. Obviously, why would you want to be in there on your own? So yeah, it worries me that they're leaving. We have cesarean women that leave after 48 hours to go home, and I've asked women, do you have, who's in your bubble at home? What sort of support do you have? And half the time it's, I have several toddlers and my husband, and it's a real worry, but unprecedented, as they say. Yeah.
Michelle, just while you're there, we do have a question, but there may be other midwives that want to jump in as well. Urs Junker has asked a question. She says, midwife advice, please, since we have one talking. I run antenatal classes for first-time mums, and they're dealing with the conundrum of having partner or mother there, wanting women's support from someone who's had birth, but feel obliged to have father of the child. Can you suggest how women deal with this decision?
Oh, that's a hard one. I mean, yes, you do want your mother, but not everybody does. It's a real hard one. You're not obliged to have your husband there or partner there or the father of the child. I mean, that's all you can tell them. It's who's going to offer the best support. And believe me, I've seen many fathers sit in the corner on their cell phone who are absolutely offer no support whatsoever. But then in saying that, I've also seen mothers or mother-in-laws doing the same thing. So I have no idea how you would approach that with a woman, except to say that she needs to consider who would be the best support and then make her decision from there. And that she shouldn't feel pressured by whichever other person is saying, no, I need to be there. That's a really hard one. It is all woman's choice, but sometimes it's not, as we know that the pressure from outside from other people is quite quite big. However, in saying that, unless the mother is in her bubble with her, or mother-in-law, then no, she can't come to the birth. So it would have to be whoever's in her bubble. And again, I suppose with level 3, we're allowed to change that now. So yeah, sorry, I don't know if that's actually much help at all.
Yeah, I think that's a very personal decision. We can't really decide. Every family is so different. Every bubble is so different. Yeah.
And I mean, some people do feel like obligated to have their mother or their mother-in-law, or feel obligated to have the father of the child. But yeah, it's a very hard choice, but it's a very personal one.
Yes, it is. And that goes back to the self-compassion of really understanding that it's your choice, and it's really about nurturing yourself and what suits you. And so many moms, so many of us as women do so much for other people, but that's a moment to just really what is best for you and try to have that. So
they have to be selfish.
Yeah, definitely in these times.
Yeah.
So we're going to wrap up. We are aware that you all want to be discussing more, and we want to do this in the future with smaller groups, because it's really hard with open up a discussion for 70 or 100 people. So we will offer in the future smaller groups of people can discuss with each other. But right now, just before we finish, as PADA, our main goal is to provide support for professionals, for midwives, nurses, anybody who works with the families. We need to know what you need more from us, what kind of resources we can give you, what support you can get from us. So if you can just kind of think about it and email us, email Trina, email me, and just let us know, what do you need from us? How can we support you better? And that tough role you have in the front line with the families and the whānau and the moms. Okay, that's what we need from you to go on from here. And Trina probably wants to say thank you again, but thank you so much for everybody who attended today. We all know that we have this huge intention to be out there and support, and it's so much harder to do that these days, but we just have to keep going. And all of you we all need that self-compassion as well. We can't function as we always do. We all have our own things going on as well. So I just encourage you to also, all the things we tell moms to do for yourselves as well. And just find the joy every day in something, and just take that walk every day and nurture yourself somehow every day. I'll go to Trina.
Great. Yeah, thanks, Liora. That's a lovely sum up at the end. We will be holding these pop-up chats each week. Next week, I'm just finalising the day and the time, but Dr. Carrie Barber will be jumping on and talking about her Positively Pregnant app. That we're then trying to find somebody to talk for World Maternal Mental Health, since our seminar in Porirua unfortunately is postponed towards the end of the year. So we'll just be finding something for that week to talk about. But also we'll be creating a lot of social media around that week as well. It is World Maternal Mental Health Week. So just, we usually encourage people to go out and do picnics and buggy walks and just sort of connecting. But unfortunately we won't be able to facilitate those. So we'll just sort of do things virtually and online. And then the following week after that, we'll be talking about the importance of dads as well. A lot of our other training has been postponed to the end of the year. Our seminars, our ones in Greymouth and Christchurch, are now going to be in November. Hamilton, 16th of June, that could possibly be changed to a full day online digital seminar, and then Palmerston North at the end of the month on the 30th of June. Hopefully we may be able to actually hold that one. And then our Māori Maternal Mental Health Hui in Auckland on the 23rd of July. So it all depends on what's happening with alert levels and government recommendations. So stay in touch with us. We'll let you know what's happening with all of those as well. But thank you all for your time this morning. I know there's always so much happening, and really appreciate you tuning in. If you've got further questions or information, then please still, we can just continue this discussion. I'm happy just to sort of keep firing emails backwards and forwards to the group and things. I've got all your details now as well. So I'm just saying, was there anything else? Thank you, thank you, thank you. Great. Yep. Thanks, everyone. Really, really appreciate it. So we've recorded the session. It will be sent out to everybody else. There was quite a few that weren't able to make it this morning. But again, just stay in touch and look after each other and look after yourselves as well, because you guys are doing an amazing job out there supporting all those mums and dads through this sort of really surreal time that we're all happening. So thanks very much. Enjoy the rest of your day.